At my hospital, I get to see a lot of really cool advancements in medicine. I particularly love getting to watch and be a part of fetal surgery.
Technology is great and it's moving at a really fast pace in medicine. It's really exciting. It's important to remember that healthcare is really about the patient. Being a physician that really knows how to guide your patients through the technology and advancements and all the options available is how we bring that connection.
Whether it be robotics or AI or anything that takes humans one step farther away from their patients, I think it's going to be just as important that we really try to bring ourselves one step closer and continue to focus on treating each other as humans.
I'm Emma Joy, TCU Harris College of Nursing and Health Sciences, class of 2021, and I am now a nurse at Northwestern Memorial Hospital in the Neonatal Intensive Care Unit.
I'm Dr. Brandon Zigray, TCU class of 2014. I'm doing my residency in neurosurgery at Loyola University Chicago.
I'm Dr. McKenna Chalman, TCU Burnett School of Medicine class of 2023, and I'm doing my general surgery residency at Rush University in Chicago.
I'm Dr. Courtney Sullivan, TCU College of Science and Engineering, class of 2017. I'm now doing my residency at the University of Chicago Medicine in obstetrics and gynecology.
Compassion and communication are a critical part of patient care because they're really the foundation for the human connection that we have with each other.
Working on labor and delivery as much as I do, it is the best day of a lot of people's lives, but it's also the worst day of some patients' lives.
One of the most important things that nurses can provide for their patients is being a supportive person for them, being their advocate.
If you come from a place of compassion, it helps them feel safe and it helps them feel heard, and that ultimately increases their willingness to be really open with you and to trust in your expertise and trust in the medical system.
Having real relationships with your patients and really leading with empathy and compassion is how you build trust in the first place.
Being able to connect with people that come from different backgrounds and diverse populations is something that is extremely important in a medical field especially.
Really clear communication, making sure they understand why you want to do the things that you do, making sure you talk to them at their level and not just use big medical jargon words, I think is really important to increase that trust.
Nursing school is challenging. It's supposed to be that way. You have to know what you're doing. You're taking care of people's lives. And I think TCU not only has a top-of-the-line nursing school that's going to teach you everything that you need to know, but they also equip you with the confidence so that when you walk into a room, you can take care of your patient and their families know that their child is getting the best possible care.
The way that I was taught to think and problem solve and kind of use all those resources at TCU, I now implement in how I practice medicine. There's more to it than just the science and the medicine. You have to be proficient in ethics and empathy and research and communicating and patient connections and things like that.
I get to practice compassion every day. We are given the opportunity to be able to sit there and help them through these hard times. We get to not only walk them through the difficult stuff, but also be there to celebrate the victories.
Compassion itself is a force that we can use to lead with integrity and empathy and be a net positive in healthcare and in the world in general.